In congressional hearings, conservatives just got another memorable lesson about insulting people who are smarter than them. At a House hearing, the debate was over government-funded universal childcare, and Lindsey Burke, a right-wing Heritage Foundation official, ridiculed Democratic Rep. Katie Porter by name, and soon discovered that was a big mistake.
If I could just, for the record, say I would not take Congresswoman Porter's investment opportunity because it's investing with other people's money, and it's making choices that they might not themselves want to make with those dollars.
I want to start by talking about other people's money, because last time I checked, that's all we spend is the American people's money. That's actually the function of Congress. And there are no dollars that we spend that do not come from the American people. So the argument that we shouldn't do something because it's spending other people's money would simply suggest that we don't spend any money at all, including zeroing out the defense budget. Is that in fact what you were suggesting, Dr. Burke, that we zero out the defense budget so that we don't spend other people's money?
No, but it is the case that
I'm reclaiming my time.
You are spending other people's money.
Always.
And that those choices need to reflect what most Americans want.
Okay.
Most Americans do not
Reclaiming
want
my time, Mr.
government-funded
Chair.
universal child
Reclaiming
care.
my time.
Most Americans do not want government-funded universal child care, said Burke. Well, that's actually not true. Most Republicans may oppose it, but most Democrats support it. And a majority of Americans, according to polls, support universal child care when they are told the costs and benefits of such funding. All the data shows that for every dollar invested in child care, $4 is returned in future economic savings and benefits. As Katie Porter noted with the help of a witness, the math is a no-brainer.
So we're losing right now $122 billion.
$122 billion that we could have in our economy, and yet what we hear around here all the time is that we don't have money to do things. So Congress has had years to invest in universal child care. Every dollar we put in would have generated, estimates show, about $4 for our economy, yet we still don't have it. Why? Ms. Potato, why don't we have this?
Well, we need to build the political and public will. The voters are there.
Okay, so the problem must be then the will of the people here, because voters support this. So let's talk about who's here. How would you describe the gender balance and average age of Congress?
It skews older, male, and whiter.
That's correct. So only about 28% of members of Congress are women. The median age in the Senate is 65, and the median age in the House is 58. So lots, on average, lots of older people, lots of older men, lots of men.
In other words, Congress is comprised of lawmakers who will not benefit from early childhood help and care. Most members' kids are grown, so the lawmakers don't have to worry about balancing work with preschool care obligations.
I would also call it structural sexism. When we say smash the patriarchy, when we say that structural sexism continues to permeate this body and this policy, our policies, that's what we're talking about. We're not imagining it. It's not about interpersonal slights. It is about what this body chooses to get done and to fund and to focus on, and what always ends up on the cutting room floor in legislation. Structural sexism is an age-old story. It's not going to go away by itself. It's going to go away because we make it go away. When we stop undervaluing the work of Black and brown women, or the majority of childcare workers, when we start recognizing that women can and must contribute to our economy if we're going to have a globally competitive economy.
President Biden has proposed spending $400 billion for universal preschool care financed by taxes on the wealthiest Americans and corporations. Experts say such a program would boost economic productivity by $1.5 trillion. But never mind the math, Porter noted there is a moral part to this investment as well. Because when Republicans argue that some parents choose to stay home to take care of their kids, Porter explained that is not an option for single parents.
Senator Vance's hypothetical says that one parent might prefer to stay home. That's probably true. There's a lot of statistics that show that parents, men and women, have different preferences at different points in time. But what about the 10 million single moms? Where do they fit? Dr. Burke, where did you put your children in childcare?
Well, I'm not going to bring my children into this hearing, so it doesn't have any bearing on this. So
Dr. Burke, do you have children?
I do.
So I'm sharing my story because my story is one that doesn't get heard in this Congress. Because you know how many single moms there are?
One or two?
One, childcare, custodial care to help people who may choose all kinds of different options. I've had full-time care. I've had three-fourths care. I had when I had a spouse, he stayed home some years. That was how we fit the pieces together. But that's what this hearing is about, not jamming one size fits all. But if there isn't the money, there won't be the choice.
Amen. And in a nation that chooses to spend $1 trillion a year on the Pentagon budget, one would think that spending a fraction of that each year to safeguard families with young children would be easy. Sadly, logic is not easy for the U.S. Congress. And by the way, you heard Katie Porter correctly. She is the only single mom in Congress. She knows full well the challenges and benefits of early child care help and assistance, and we should all be grateful that Katie Porter, Democrat from California, is speaking out.
I think here's the problem. Pharmacy benefit managers today are the worst kind of middlemen. You stop competition, you prevent transparency, you manipulate markets, and you make our healthcare system more complicated. Dr. Kutzner, you said healthcare is hard. No. The practice of medicine is hard. Healthcare is just a profit center in this country. Humira's rebates were at least 40 to 60% of the drug's list price in 2023. Does that sound right to you?
It's in the ballpark.
Okay.
Whenever Representative Katie Porter brings out the whiteboard, you know things are about to get serious.
This is your value in the marketplace, correct? Negotiating this rebate. How much did Humira generate in sales in 2023? Do you know?
I do not know.
14.4 billion, $5.6 billion. Did all that money that you got as a rebate, did it go to patients?
The rebates were passed through to our customers, the employers, the organizations that fund healthcare in this country, and then they use those dollars, in some cases, to actually pass it on to the members.
You didn't retain any of that rebate?
As we mentioned in my opening statement, CVS Caremark passes through 99+% of all the rebates that we negotiate with the manufacturers.
Exactly. All of these negotiated rebates between drug companies and pharmaceutical benefit managers do is protect the biggest manufacturers, push out competition from generic alternatives, and boost profits for their own companies when they could be serving patients instead. Just minutes before, Porter illustrated how these PBM companies maximize profits to our detriment. Representative Summer Lee took these crooks to task herself.
In southwestern Pennsylvania, we are deeply familiar with the consequences of concentrated corporate power in our healthcare systems. Whether it's a hospital system, a health insurance conglomerate, or both combined, the consequences of healthcare monopoly are always the same: higher costs, reduced access, and worsened health outcomes. And with health insurance companies like United Health, Cigna, and Aetna, it's evident that through their monopoly power, they've been able to rig our healthcare system to prioritize profits over patient health, capitalizing on each level of the drug supply chain to boost shareholder returns. Last year, the parent companies for all three PBMs testifying here today were incredibly successful, as evidenced by their windfall profits. And I know that some of my colleagues before me have gotten at this, but I'm still curious. Mr. Joyner, how much total revenue did CVS Health report in 2023?
The Caremark revenues were just shy of $180 billion.
Thank you, Mr. Costner. How much total revenue did Evernorth Health Services report in 2023?
Congresswoman, I don't know the exact amount, but it's certainly within the filings that we provide. What I can say is...
Yeah, I believe it's $153.5 billion. How much of that total was attributable to Express Scripts?
So we don't report the Express Scripts segment on its own, so I couldn't provide that information.
Okay. Thank you. Dr. Conway, how much total revenue did United Health Group report in 2023?
I believe it was in the high $360 billion in terms of revenue for the whole group.
How much of that amount was attributable to Optum Rx?
$116 billion was the revenue of Optum Rx last year.
So while your three companies earn billions, Americans continue to pay some of the highest costs for medications in the world. Last March, the Kaiser Family Foundation released data showing more than a quarter of adults said it was either somewhat or very difficult to afford prescription drugs. For people of color, 60% of Black respondents and 65% of Hispanic respondents reported difficulty affording health care. And this is despite your claims of negotiating significant rebates from drug manufacturers to lower drug prices. So to any of you, it appears that this system of rebates actually benefits the PBMs rather than the patients, as we've been talking about. How do you explain this discrepancy?
Representative Lee knows a thing or two about fighting healthcare and health insurance monopolies, as she's been a frequent and vocal critic of how Pittsburgh healthcare giants, UPMC, AHN, and Highmark, have kept worker wages low, crushed unionization efforts, gobbled up land, priced out smaller hospitals and insurance firms, giving out record bonuses to CEOs and et cetera. So she knows what she's talking about.
Anyone? Dr. Conway.
So we compete in a market that is competing on lowest net cost to the customer, clinical programs, transparency, and choice. It's a highly competitive market. I've been in this role for about a year. And our retention rates are 98+% in Optum Rx. And within that market, we work each and every day to make drugs more affordable, to your point.
But they're not more affordable.
So as I mentioned earlier, we've got over 290 drugs now in a program we rolled up that is $0 or $5 copays, so less than $35, typically $0 and $5. I agree with you that we need to continue to work along with stakeholders across
Thank you.
the system,
Yeah, thank you for that.
Manufacturers to make it more affordable.
Thank you. Just stick in there. Last year, Optum Rx's former CEO testified before the Senate Committee on Health, Labor, Education, and Pensions. She explained that some of your customers, quote, choose to compensate us for the savings we generate in the services we provide by opting for us to retain a small fraction of discounts we negotiate with pharmaceutical manufacturers. For companies that choose this compensation model, what percentage of the discount you negotiate with drug companies does Optum Rx retain on average?
The majority of customers choose 100% rebate pass-through. On average, across the entire book, it's 98% of rebates that are passed through to our customers.
Your former CEO stated that, quote, other customers prefer that we pass along 100% of the savings we negotiate. So on average, how do clients who choose this model pay Optum Rx as an administrative fee?
They have a set of choices in how they pay us. Some of them choose administrative fees. There's a set of options that we provide to them transparently that they select and how they reimburse us for our services.
It's clear that the savings you are claiming to be providing to patients are either woefully inadequate or not reaching them at all. I look forward to working with my colleagues to rein in PBM monopoly power and lower drug costs for all patients.